Well, January is Alzheimer's Awareness Month, and that disease is one of the many conditions that we see more and more of with Canada's rapidly growing elderly population. Get this, 20 years from now, the number of seniors over 65 will double, the number of seniors over 85 will quadruple, leading many to call this the silver tsunami. Well, Green Shield Canada's Executive Director, Sarah Sayso, joins us now to talk about this and the efforts, really, to overcome some of the challenges it presents. Thank you so much for coming in.
Thanks for having me.
Well, you hear those numbers, obviously shocking. How do we sort of overcome this so we don't get swallowed or we don't drown because of this?
Well, the Green Shield Canada Foundation formed a collaborative of 5 non-traditional health partners, and by that I mean 3 hospitals and 2 community organizations who are working around seniors with multiple chronic conditions and how they would age at home. So a lot of seniors go into hospital, and the transition from hospital to home can be quite daunting, and it's how we can work together, 5 organizations, to help these seniors cope, because many of them can age in place in the comfort of their own home. So that's what we're working on.
Talk about some of the organizations that you're involved with.
So we're working with an organization called Sprint Seniors Care, which Dr. Mark does house calls, takes a multidisciplinary team into the home to look at patients and figure out what kind of care they might need. We have Bridgepoint Health, which has a health gateway, which is an online resource for patients and caregivers to find access to information. We have University Health Network eConcierge, which again is going to be linking patients to and caregivers to information they need when they need it. We have Alzheimer's Society of Toronto, and we have St. Mike's Virtual Ward, which helps patient transition from hospital to home 30, 60, and 90 days, again, with a multidisciplinary team that looks at their needs.
How do people seek the help?
So we have gscfoundation.ca has a list of all the organizations and the projects, and you can find really great detail about each of the projects and how to get in touch with the organizations to access what you might need.
How difficult is it to, I guess it's more of a broad question, but to stay ahead of the curve? And sort of going back to the earlier point, so we don't get swallowed by this, this is a growing problem. But how do we stay ahead of it?
So we looked at the Drummond report that told us that this was coming, and we brought these organizations together to say, what can we do collaboratively to look at it? And that's what we're trying to do. We've got a 3-year project, $3 million, and we're trying to, improve on a bunch of different things. One is helping caregivers. Right. Help the patients, access to information when you need it, to keep patients out of the hospital and to keep them with the proper access to care at home. And
so often the caregiver is a family member.
Yes.
And obviously this creates so many additional problems, the emotional strain, the financial strain in many cases.
Yes.
What can we do to help these people?
So if you look at a program like Sprint, you can get a house calls doctor and a multidisciplinary team, everything from a personal support worker to come into your home and assess what you need and help you get the care you need in the comfort of your home. We look at Alzheimer's being Alzheimer's Awareness Month. They're bringing a program which is a classroom program to train caregivers and patients about dementia care, personal support workers, I should say, and caregivers about dementia care. And they're taking that program online, so anybody in any part of the country can take that course and learn how to help people that have early onset dementia in the comfort of their own home.
I understand we have images of one of the doctors making house calls.
Right,
Tell us about him.
So Dr. Mark is an amazing person who gave up his practice and decided to start treating patients where they live so that they can stay in the comfort of their home. People are isolated and frail sometimes, and the socialization even of just having Dr. Mark come and see them is a big support for them. And he's, of course, looking at patients and following up on their care, and in some cases liaising with the hospital to make sure that they get the care that they need at home, and so they don't have to go back to hospital.
What are you hearing from people in terms of what they need the most now?
I think there's a sandwich generation. My parents are in their 70s. We all have aging parents. There's a lot of pressure. You're raising kids, and then you have your parents to deal with. So it's really access for caregivers to the information that they need when they need it, how they need it, which we're trying to build, and then for the patients, because a senior feels a lot of stress put on their child or their caregiver to look after them. And so again, making sure that they have the information they need when they need it.
Well, thank you so much for shedding light on this incredibly important subject.
Thank you for having
Sarah Sayso from Green Shield Canada. Thanks again.
Thanks very much.
All right, we'll be back after this.